Thanks, Ellie. I had to remember to turn my mute off. So good afternoon, everyone, and thanks for joining us again today. Earlier today, we announced new measures to protect the health and safety of residents in the Beaufort Delta community of Tuktoyaktuk. The containment order issued for Tuktoyaktuk takes necessary steps to prevent further spread of the virus and any additional strain on our healthcare system. These type of restrictions have worked in other communities, and we're confident that we'll be successful. To residents in Tuktoyaktuk, please follow the orders, stay home, and stop the spread. As we've seen in communities like Wati, Katludeche First Nation, Betchiko, Hay River, Yellowknife, Dido, and Deda, following the orders and public health recommendation works. We know this is a difficult and at times scary situation for residents in Tuktoyaktuk and the Beaufort Delta. You haven't experienced a significant number of cases or community spread, but we're committed to supporting you through this. We will continue to work with local leadership at all levels to provide regular updates and guidance as the situation evolves. The government of the Northwest Territories has a number of programs and services available to support residents during this time and can be found on the government's COVID-19 website. We said that we'd use every tool at our disposal to ensure we're able to protect residents and communities, but also to ensure that we can move forward and support a return to normalcy. I know this continues to be a difficult time for many residents, but we're moving out of the outbreak impacting our territory. The communities impacted by a high number of cases in the last few months have all shown improvement. Full of cases or back to zero cases in their communities. The efforts over the last few months have shown that containment orders work. And as long as the residents in Tuktoyaktuk follow the public health orders, I'm confident that we'll have similar results. We all need to continue to do our part and make good decisions that support our collective efforts to curb the spread of the virus. We can do this. I know it. I'll now turn it over to Minister Green. Thank you again, everyone, and stay safe.
Thank you, Madam Premier, and good afternoon, everyone. Thank you for joining us today. I want to start by acknowledging those families and communities who have lost loved ones to COVID since our last media event. We are now up to 11 deaths. It's a real sadness to stand before you again today to announce yet another outbreak in one of our communities, this time Tuktoyaktuk, and to answer questions about the containment measures that have been put in place. It often seems that every couple of steps forward we take in the fight against COVID-19 and towards a return to normal, we're forced to take a step backward, and that's certainly true today. Countless times, we've had to brace ourselves for the unexpected, as this virus and its variants have proven to be unpredictable and persistent adversaries. But just as we have in the past, we will adapt, rally together, and meet this challenge head on. The situation we now face in Tuktoyaktuk is one NWT residents are becoming more accustomed to, but that certainly doesn't make it easier for those who are affected by COVID in the community. Local leadership and our healthcare staff are doing an incredible job on the ground and working diligently to keep residents healthy, safe, and informed. And while I'm confident we will emerge from this outbreak quickly, just as other communities have, it's important that we all continue to do our part in this fight by doing what we know works. While it may not be the bulletproof defense against this pandemic we'd originally hoped for, vaccination still remains our best weapon in the fight against COVID-19. We would love to see vaccination rates go up in Tuk from the current level of 72% fully vaccinated and 83% partially vaccinated. And finally, to the residents of Tuktoyaktuk, we are with you. Your local leadership and community resiliency is strong, and our government will do everything we can to help support you. I'll now turn things over to the Acting Deputy Chief Public Health Officer, Dr. James Talbot. Dr. Talbot has had a long career in public health, most recently as Alberta's Chief Medical Officer of Health, and he's been kind enough to join us while our CPHO, Dr. Cambola, has a break. Over to you, Dr. Talbot.
Thank you, Minister, and good afternoon. Thank you all for coming. We've been monitoring the situation in Tuktoyaktuk closely since the initial cluster of 4 cases was reported to my office on Sunday morning. NTH SSA responded very quickly to the situation, and with assistance from the rapid response team, the local team of health professionals increased testing capacity in the community so we could get a better handle on how many people had been affected. This led to the discovery of an additional 12 active COVID-19 infections. The total number of active COVID-19 infections in the community now stands at 16. That's likely to increase as we do more testing, but that's to be expected in the early stages of an outbreak. This transmission is similar to what we've experienced in the other communities mentioned by the Premier and the Minister across the Northwest Territories. So as they say where I came from, this is not our first rodeo. But when an introduction of COVID-19 infection has happened and led to community transmission, the Territory has come together to make sure that everyone is protected. And that's what we're doing today. Because of that community transmission, we have issued a public health order for the community, and this temporary containment order is in effect for 10 days until November 19th. As we've seen in other communities, this is often enough time to contain the spread of COVID-19 if the restrictions outlined in the order are followed. I spoke with Mayor Elias last night, and he confirmed that the local leadership had already mobilized and was making good choices on behalf of their community members. So the containment order is in effect just reinforcing the common sense approach the mayor and council were already demonstrating. We'll continue to monitor the situation in Tuktoyaktuk and adjust our response as needed. These containment orders are difficult, but they have proven to work in our northern communities. I'd like to emphasize 2 other messages as we go forward. If you are eligible and not yet fully immunized, please do so as soon as possible. It's a safe and effective way to protect yourself, your family, and your community from severe health outcomes from a COVID-19 infection, and it's never too late to get it. And that includes the people who are in Tuktoyaktuk. I encourage all Northerners to book their first, second, or booster dose of COVID-19, of the COVID-19 vaccine. This has been a long, tough 20 months. Everyone is feeling anxious, worried, and maybe even a little bit sad as the pandemic continues. But it's important to recognize how far we've come. We have weathered what at the beginning was a situation where there was no vaccine available and no one knew how bad things could be, to the point where we can see the light at the end of the tunnel. And that's because everyone in the territories has pulled together, because your government has made wise decisions and your healthcare system has been magnificent. So even though it's understandable that we might be feeling a little anxious or worried or sad, we need to be proud of how much we've accomplished and how well we've come together. We've been through this before and emerged successfully, and we're going to do so again. But because we're feeling those same emotions, I want you to remember a golden rule: to treat everyone with the same kindness that we in turn wish to receive. Be supportive of your community members while we work together to get the job done. Remember, be safe, be smart, and look out for one another. Thank you.
Thank you, Dr. Talbot. Now I would like to turn it over to the media for our question period. I have posted the order for questions in the chat, but I'll go through the list again right here. First, we have both Mariah and Luke from CKLB. So I'm not sure who will be asking the questions there. Then we have CBC. Then we have Ethan from NNSL. Then we have Sarah from Cabin Radio. Then Mario from Radio Canada and Tamara from APTN. I will give you each an opportunity for one question and a follow-up. And just a reminder to please let us know who you would like to direct your question to, and to unmute yourself and then mute yourself again when you're done posing your question. So first to Luke or Mariah from CKLB. Are you there?
Yeah, it's just Luke here.
Okay, go ahead, Luke.
All right. Yeah, I got a question for either Dr. Talbot or Minister Green. I'm just wondering if there's any idea how the cases got into Tuck, and if there's any need for policy changes to prevent it from, continuing to spread to different communities. Thank you.
Thanks, Luke. I think we'll let Dr. Talbot go ahead on that one first.
Well, we're continuing to investigate. It's not completely clear how it arrived, but that is a major part of the contact tracing and investigation, is to determine how it entered and to make sure that we reduce the chances of that happening anywhere else. I don't think I'm speaking online when I say that we do know that our sister territory is wrestling with a significant increase in the number of cases, but we don't yet have a link to show that.
Thank you, Dr. Talbot. Mr. Green, anything to add there? No. Okay, Luke, do you have a follow-up question?
For Mayor Elias, I just know in some of the other outbreaks like Betchco and Fort Good Hope, there was issues with isolation space for housing, or housing for isolation spaces. I'm just wondering if that's an issue as well in Tuck.
Yeah, so
Mayor Elias, are you there? Oh, go ahead, yeah.
Yeah, so obviously it will be an issue here, if we have to house anybody and stuff like that. And but I mean, like everybody said here earlier, is that we are working together, and we do have the support that is available for us. So again, it's all about like what Dr. Talbot said, is we got to figure out who's in need, and go from
Thank you, Mr. Mayor. Moving on now to CBC. I'm not sure who is with us from CBC, but is there someone there?
Yeah, it's me, Sydney Cohen.
Okay.
I was wondering, I know it's a small community and there's privacy issues, but I'm wondering if you can speak at all to who these cases are affecting, if it's children. I mean, we saw the outbreak at the school in Inuvik, or is it unvaccinated household clusters? Maybe you can shine any more light on that. Thank you.
Thanks, Sydney. I think we'll ask Dr. Talbot to speak to that, and then perhaps Arlene as well.
The initial case was, the initial cases were in a single household, but we expect as we do more testing, we find additional cases. My understanding is that there are now 4 households. They do include children who are in school, so that's why closing the school is part of the strategy going forward. But there are adults affected as well. I expect as we go along, we will find that it's gone beyond those bounds, but as we go further on, we expect to find fewer and fewer of them.
Thanks, Dr. Talbot. Arlene, anything to add from your perspective?
Sorry, I got off mute. The only thing I would add is that, Tuck is a small and close-knit community. So, people across age ranges and across have a lot of relationships. And so an individual who maybe have COVID would have a number of different contacts just because of the relationships in the communities. I think that if you take a look at the exposure sites as well, then you can see that there were a couple of grades. I think 9, 10, and 11 that there was an exposure in. So we recognize the high school in particular had some impacts, as well as the youth center. So I think that in the community, we just need to recognize that each one of those contacts will have a broad range of people that they're connected to. So that's why the contact tracing is really important, and the staff in TUC are working really hard on that now.
Thank you, Arlene. Sydney, do you have a follow-up question?
Yeah, you mentioned that there are supports available to people in the community. I'm just wondering if you can elaborate a bit on what those supports are, like helping people get food, but also the mayor said that they're working, that housing might be an issue for like isolation. So maybe you can speak specifically to isolation supports. Thank you.
Sure. Sure. Thanks, Sydney. Okay, first, I think we'll give that question to the mayor. Mayor Elias, are you there?
Yes, I am.
Did you hear the question?
Yeah, so in regards to the housing situation here, again, it's undetermined yet as we go forward here. And obviously, we're going to have to be reaching out to the housing department and whatever departments it takes to try and accommodate, if we run into the situation. But right now we don't have, proper facilities. We're doing a retro on our school right now, which was what part of the plan earlier. So again, it's something that we're going to have to deal with going forward and plan, in case it's a need.
Thank you, Mr. Mayor. And I'm just going to ask if either Arlene or perhaps Minister Green have anything else to add on that question with regards to supports in the community. Go ahead, Minister Green.
Yeah, the health authority sent a rapid response team to Inuvik yesterday. They're on the ground to assist with contact tracing and testing. So we want to make sure that happens as quickly as possible, and we put resources in place to make that happen. So I don't know if Arlene wants to add any more detail to that.
Sure. So two things in relation to the concern around the supports in the community. We are having, there's going to be an emergency operations committee meeting this afternoon with some of the government departments, just to have the conversations around what kind of supports would be available from other departments. And so I think that's Mayor Elias has identified really clearly what some of the needs are in the community. And he's also, I'm aware of, connected to the grocery stores and done some work on the ground to support people. So there's some work that's already being done. In addition, the government departments are going to be meeting to talk about what additional resources can also be provided to support the community. So I think that's underway. In terms of what the NTHSSA is doing, so yes, there is a rapid response team. So this is the health services, which included, we sent in an additional 3 testing devices. So they have 4 testing devices on the ground now, which means they're able to do much more testing much more quickly. There was an additional 2 nurses plus a logistician to help with coordinating and looking after the machines. That arrived on the ground yesterday. We began testing yesterday afternoon and are continuing to do that testing today and tomorrow, doing our best to reach out and connect to and schedule in everyone who needs testing. There's fairly long lists of contacts, and so we're working hard to make sure that everybody gets their appointment as they need it and are scheduled in and are working through some of the bumps in that road. But in the meantime, some really good advice coming from the hamlet itself, as well as public health in general, around, in the meantime, staying home, keeping their circle small, and doing all this stuff that the folks in TUC already need to know how to do. We've also been posting some of the mental health resources, and the hamlet has been really supportive in posting those on their Facebook pages as well, which include wellness workers. We've got some counselors that are accessible by phone. We've got a number of different resources from within the community and the region for mental health resources as well. So those are the kinds of things that are in place.
And Ali, if I can just add from the COVID Secretariat, whenever there's an outbreak throughout the Northwest Territories, we move in our team. We have regional enforcement officers in every region. However, when there's an outbreak, we move the team to where the outbreak is. So you'll see more people from the COVID Secretariat, the enforcement branch, moving into Tuktoyaktuk, and if not today, in the next coming days. And we've gone through these outbreaks in many communities. And so there are standards that we have in place, but every community is different. So that's why it's really important that we work with our local emergency response team to make sure that their needs are met, and that we don't make the mistake and say that one community is the same as all. So it's about working together, being really closely connected, all leadership, and that's what we're committed to doing.
Thank you, Premier Cochrane. Next on my list is Ethan from Northern News Services. Ethan, are you there? Can you hear me? I'm sorry. Ethan has posted a question in the chat. This is for Dr. Talbot. Regarding the recent outbreak, what is the percentage of vaccinated versus non-vaccinated cases?
I think Arlene just gave that, but I think it's 72% fully and about 84% at least one dose. So those are, to put that in context, those are good numbers. But particularly right now, we'd like to see those numbers go up because we don't want anybody in the community to suffer severe illness or end up having to be in hospital or worse. So this is a good time to remind the people that you care about that you would like them to be around next year at this time, and that the best way they could do that is to get a vaccine.
Thank you, Dr. Talbot. Ethan, if you have a follow-up, you can go ahead and post it in the chat. Oh, here it is here. Apologize. How many of the 12 new cases are under the age of 12?
I don't have that at my fingertips. Arlene, do you have any? If we don't, I can get back to you after this.
Sure, thank you. Ethan, we'll follow up with you after the briefing today. Next on the list is Sarah from Cabin Radio. Sarah, can you hear me? Sarah? I can't hear you. Sarah, yes, there we go. Go ahead.
Okay, sorry about that. Sorry, I was just looking at the COVID-19 dashboard. So in the 12 and up population, only 70% of people are fully vaccinated. In the last couple of days since these initial cases have been identified in the community, have you seen lots of people coming in the last couple of days to get their vaccine? Has there been an uptick there?
Arlene, do you have an answer to that question, perhaps?
Sure, I can respond to that. I don't know the numbers of people that have been, but I do know that we've been advertising and we continue to have walk-in vaccinations available at the community health center from 1 to 4 every day, and are certainly promoting that at the same time as this situation's evolving to ensure that anyone who makes the decision this week is able to have access to the vaccines. But I don't have the numbers of whether it's been increased or how many vaccines we've given out this week.
Okay, would we be able to get that information after this?
Yeah, we can follow up with you, Sarah, after the briefing as well.
Okay.
Do you have a follow-up question?
Yeah, I was just wondering, this is probably for Mr. Elias, just what the kind of sentiment is in Tuck right now. There's been lots of messaging out from the government about how everyone needs to stay calm, and that messaging's come a lot quicker than it has with other communities. So just wondering if that was just more like proactive messaging or if that's in response to kind of how the community is feeling right now.
Yeah, so for the community, the feeling, again, this, like everybody knows, is the first time it's, COVID has hit our community. So there is some concern, with the testing. There's a large number of people that need to be tested here. So people are sitting at home waiting. I think overall, though, the community understands the seriousness of it. And this was, one of our worst fears, for since we heard COVID coming into the north. So so far, I think that the community has been really responsive and staying home and staying within their bubble. And I think that the community is well aware of the seriousness again. And yeah, I mean, it's again, it's so new to us right now. Obviously, a lot of questions being asked, and the biggest thing for us right now is to make sure that we can communicate and educate the community. So that's what we're trying to do right now, to try to keep everybody positive and safe. And yeah, so that's where we are.
Thank you, Mary Elias. Next on my list is Mario from Radio Canada. Mario, are you there?
Yes, I'm here, and my question is probably for Dr. Talbot, but more also maybe Arlene. Can you give us a rough number of how many contacts have been identified, or how many? We keep hearing that a lot of people need to get tested. Do you have some kind of rough number on that? How many tested, or how many tests?
I'll defer to Arlene. She's a lot closer to the front line on this one.
Sure. I don't have the total numbers to date, and I would say that as contact tracing continues, that's still a bit of a fluid number. I will say that we tested yesterday from, I believe they started around noon and tested later on into the day, although they only started with one machine and ended up with 4. Today we have spots for 144 people, appointments. Those appointments have all been filled, and we will be by tonight. Tonight we'll be contacting folks that are still waiting for their appointments and be scheduling for the full day tomorrow. So I'm anticipating, between the contacts and the folks identified through the exposure notices, I am guessing there will be, 250 to 300 is just a rough estimate at this point, but certainly the 144 today spots were filled, and we have people waiting to still to be booked in for tomorrow.
Thanks, Arlene. Mario, do you have a follow-up question?
Yeah, I don't know if it's really a follow-up, but let me still ask you the question. I think it will be for Dr. Talbot. Can you talk about the answer to the booster shots so far? Do we know if we'll be providing any numbers or details on what percentage of the population has gotten their booster, and what sort of impact does that make for the work that you do?
Well, first of all, Dr. Condola was really proactive on making sure that people understood, particularly within government, the need to move towards booster shot because of the circumstances in the north, where you're very, very rapid in getting people immunized who are at the highest risk, and follow the instructions of the manufacturer, which was to do that with a month in between. And so the good news was that you had your most vulnerable population protected really early and for long periods of time. Those are the groups, though, that are starting to show some waning immunity. And Tammy and her folks picked that up early, got support from the government to move towards boosters. The boosters haven't even really been pushed yet, and but my understanding that the bookings for them are full into the next 4 weeks or so. So she was very pleased at the uptake, and we'll be continuing to update the information on a regular basis as to how many people have been immunized. But so far that is working very well. And I think it's probably part of the reason that the numbers in the territory of cases continue to decline, even with these setbacks.
Thank you, Dr. Talbot. Next media member on our list is Tamara from APTN. Tamara, are you there?
Yes, I am. I think everything was covered on my end. Thank you so much for adding me to the call such last minute. But I don't think I have any more questions.
Okay, no problem. Thanks very much for joining us. We are 8 minutes before the hour here, and I am cognizant of the time, and I do not believe we're going to have time to run through the entire list of media again. I do appreciate you joining us here this afternoon. We will follow up with those folks who have asked questions that we have promised follow-ups to. If you do have further questions beyond what has been discussed here today, please do follow up with the press secretary, and we will do our best to get your questions answered in a timely fashion. I would like to thank again our panel members here, Premier Cochrane, Minister Green, Dr. Talbot, Ms. Jorgensen, and Mayor Elias for joining us this afternoon. We wish the residents of Tuktoyaktuk well and a speedy process in getting through the containment order and back on the other end of things. Thank you all again for joining us, and enjoy the rest of your day, folks.